all of us in very different ways. Some of us have lost family members, friends, clients. Some of us have gotten sick ourselves from COVID, while others have had exposures and scared and had to quarantine. Some of us continue to deal with personal impacts of COVID, such as having kids being homeschooled, family members losing jobs, increased anxiety and mental health issues. And at Caring People, we have made every effort to stay connected with all our caregivers and clients throughout this pandemic to provide caring and support. As the reality and impact of COVID continues to shift, we wanted to get together today to discuss everything COVID. I know that might sound like a lot to take on in half an hour. How can caregivers safely provide care to this most vulnerable population? What precautions are we taking to ensure that everyone remains safe and provides necessary care? And ultimately, we're going to listen to the long anticipated COVID vaccine and have a discussion about it. We have three incredible presenters today, and I'm sure everyone will gain a lot from the conversation. Christine Delio, who's our Regional Director of Operations for New York, Tiffany Ewell, our Director of Staff Development for New Jersey, and Jenny Porter, our Home Healthcare Supervisor for New Jersey. Jenny's actually celebrating, I think, 18 years with Caring People this year. Yes, congratulations to you, Jenny. We will at the end have a question and answer session. We are going to ask folks, if you have a question, to raise your hand. There are a lot of reactions and features on Zoom where you can do that, and we'll go through and try to get as many questions as we can. And at the end of the presentation, around 10 o'clock, we're going to pick a name for the winner of the $50 gift card, Amazon gift card raffle. You have to be in it on the webinar for the entire time to be entered into the raffle. Now I'm going to turn it over to Christine Delio.
Good morning, everybody. I'm so excited to be here with you all today. As Adina said, it's a kind of an everything COVID conversation we want to have with you guys. So just to go over some COVID-19 facts, which I know are pretty commonly known at this point, but we'll just give a quick review. So we all know that COVID-19 is an upper respiratory disease that is spread through droplets, either from our mouths or our nose. In March of 2020, it was declared a worldwide pandemic, 109 million cases worldwide, 2.4 million deaths worldwide, 27 million cases just here in the US. And of those 27 million cases, 486,314 deaths in the US. At Caring People alone, we have served well over 100 clients that have been COVID positive across the 6 states that we service. Throughout COVID, we have been following and adhering to the CDC guidelines. They are always changing, and we are changing our policies and procedures along with that. So just a little background and reminder of how far we have come at this point. Let me just get to the next slide here. So we have some statistics, and they're a little disturbing to look at. I mean, we're all looking at the same numbers here. So this information was pulled just on the 17th of February. So it's very current. You can see we did go through the second wave, which was anticipated through the November, December, January months there. But the good news about this, even though that you do see such a spike in the winter, there's a 43.7% downward trend in US cases and 32% in US deaths. So 43%, that's huge. That means almost a 50% decrease just in the last 2 weeks. So what's causing the decrease? We are hoping that a lot of that is attributed to the vaccine that is now available to our healthcare professionals and to folks that need it most. So we're going to talk a little bit more about that today. Alrighty, so 8 out of 10 COVID-19 deaths reported in the US have been adults 65 years and older. As you guys all know, that's who we service. Those are our clients. So that's why this is so important for us to be talking about and be constantly learning more about. So what are some benefits for working with COVID positive clients? And that was one of the biggest reasons we wanted to have this call here. So we've serviced well over 100 COVID positive clients, but we had been given so many more than that we haven't been able to service because we haven't been able to provide caregivers that are willing to go. We want to be able to answer all of those questions for you and really encourage you all to participate in this and work with COVID positive clients, and just be assured that we are taking every precaution needed to make sure that you're safe and that we're still able to service these clients. One of the biggest benefits to working with a COVID positive client is you are providing care and companionship for people who are completely isolated and vulnerable. I know on Long Island, we have serviced a lot of COVID positive clients, and we even service people to bring them home just so that they could pass away with their family. And we've had people say to us, you know, you wouldn't believe how grateful we are that you were able to be there and you were able to help my loved one. So that's a huge benefit to working with COVID positive clients. We're able to help people in their most vulnerable state. Another benefit for working with COVID positive clients, there are a variety of shifts and hours available to work around your schedule. If you are willing to work with a COVID positive client, you can pretty much just pick any schedule you need because we have so much need for it. So overnights, day shifts, all that kind of stuff. And the bonus to working with COVID positive clients is we offer hazard pay rates. So it's at a higher pay rate. So the family is paying more, the clients are paying more, and we're able to pay you all more while you're working with COVID positive clients. Anybody who's on the call that's already done that, you have experienced that already. And just bear with me, my slide. So we have a poll here. So Adina, I'll put it over to you.
Okay, I'm going to launch a very quick poll about your comfort level about caring for a COVID positive client. Something should pop up on your screen, and there are 3 options. Just pick one of them.
Okay, so the question is, have you or would you care for a COVID positive client? You can answer and we'll see what everybody picks here.
We'll give about 30 seconds for this. If you got a pop up, you have about 10 more seconds to respond, and then we'll close it out. 5, 4, 3, 2, 1.
All righty. So the question was, have you ever or would you ever care for a COVID positive client? So we have about 70 people on the call. 50 people have responded. It looks like 35% of people on this call have cared for a COVID positive client. Another 22% say that they would, but they haven't. So that's a great number to have there. And then we have 43% is no, I don't feel comfortable caring for a COVID client. So I think these percentages are go along, Adina, would you say, with the research that's out there right now? And that's why we wanted to step in and have open conversations about this and talk to everybody to try to ease those concerns and see if we can push that number up a little bit to get more people willing to work with COVID positive clients, or just provide more education. At the end of the day, it's a personal decision. Thank you for participating in that. All right, and I'm trying to go to the next, and I'm going to turn it over to Tiffany now.
Oops, let me clear my screen. Good morning, everyone. So I'm just going to go over some of the things that we need to be mindful as caregivers when it comes to caring for our clients, as well as caring for COVID positive clients. Obviously, we have to assume almost that any caregiver or any client can be COVID positive, but for those that are not, that we know that aren't, we do expect you to take the necessary precautions, not only for yourself, but also for the family, for the client. So you wanna make sure that you wear your mask and your gloves. We have been providing everyone with mask. And then some of you I know have worn double mask, but you wanna make sure that when you are wearing those masks, you wanna make sure that it's covering your nose and your mouth, because as we know, the virus is spread through droplets out of the nose and mouth. in addition to wearing your mask, you want to make sure that you're wearing your gloves. Now, again, this is something that we should be doing anyway, even if the client is not COVID positive. One of the things that is somewhat of a pet peeve of mine is that I've done home visits where I see caregivers walking around with their gloves on or answering the door with their gloves on. When I walk in, I don't know if you're providing care, but we want to make sure that we're using the gloves definitely during care, but also when we're washing the dishes, also when we're doing laundry. We don't want to do laundry it might be soiled laundry with your bare hands. So we want to make sure that we're using the gloves as much as possible, but also be mindful of, cross-contamination. When you remove the gloves, you want to make sure that you are washing your hands properly, washing your hands thoroughly for at least 20 seconds with warm water and soap. If you don't have hand soap, and I know that we have had clients that I've gone or caregivers have said to me, oh, Miss Tiffany, there's no hand soap here. So I would suggest if you're a live-in or even maybe a 12-hour shift, you can always carry, if you want to bring your own pump of hand soap, you're more than welcome to do that. But also I would suggest even keeping hand sanitizer with you at all times. And, just rubbing your hands with it for, again, 20 seconds. They do recommend that if you're using hand sanitizer, that you're choosing to use one that has at least 60 to 70% alcohol. Another one of the big things that when you're caring for your clients is definitely regularly cleaning the surfaces, keeping the bathrooms clean, keeping the kitchens clean, the tables. I know that a lot of our clients, I had a caregiver the other day who said to me, Tiffany, the client never washes her hands. So I said to her, she's like, the only way I can get her to wash her hands is to give her like the diaper wipes, which those don't necessarily have alcohol. They're just kind of wet. So I did say to her, well, maybe we can suggest to the family to get actual wet ones with antibacterial soap in it. So that's just, some little tidbits of information. But again, you want to regularly keep all your surfaces clean. I would also suggest taking a wet wipe or disinfectant wipe to clean those door handles, to clean the light switches. Also, one of the things I have seen during my home visits is our caregivers I know you're providing care, but I'll see them with the lotion bottle, the bedpan, that they have the soap and water for, as well as the A&D ointment or the barrier cream, and they have their gloves on and they're touching all of those things, including, as well as things on the dresser. So with their gloves on. So maybe it would be a good idea that, before you finish care, switch your gloves and maybe wipe everything down again, because especially if you are on a shift where you share the case with other caregivers, again, you want to walk into a clean and a clean home. There was something else I wanted to say about the disinfecting. Can't remember right now, but again, we do encourage all of our caregivers to get tested weekly. I know that we have had caregivers that tested routinely, worked double, 2 jobs, and they came back COVID positive. No symptoms, but definitely COVID positive. So we are encouraging for you guys to get tested weekly as well. So, you got it, Christine.
I was so busy agreeing with you that it was a little behind. Sorry about that.
No problem. So when we actually know that our clients are COVID positive, we want to do all the things that we already do, whether we had a pandemic or we don't. Oh, going back to the disinfecting, I remember now. We also want to make sure that we are wiping anything that we share. So that means the remote control. You can take a disinfectant wipe to wipe down the remotes, the phones, anything of that sort as well, that you might touch, as well as the client. But when we are working with a COVID positive client, so thank you caregivers for the ones that are comfortable and have worked with our COVID positive clients, we do want to make sure that we are mindful of how close we come into contact. And when I we know you have to provide care, but we are also going to support you by providing you with the proper PPE. So for those caregivers, I know I had a client who tested positive, but she had a night shift. So the overnight caregivers were potentially exposed, but when we called all of the caregivers, they said when we did check the client during the night, they had on their N95s or KN95s. And they were in the room with the client for less than 15 minutes. So in that case, their exposure time was minimized at that point. So just again, keeping that 6 feet distance and making sure that our masks are again covering our nose and our mouths. We know that for the caregivers that are working long shifts as well as live-ins, you do have to take snack breaks or lunch breaks or dinner breaks. But again, be mindful. Maybe, have your lunch after the client has had your lunch, because at that time your mask is off. And again, while you're eating, particles can fly out of your mouth. So I know that some of our clients like the caregivers to sit with them while they're eating, maybe not eat at the same time, but it's okay to sit with them as long as you have your mask on. And I think it's good for you as a caregiver to explain to a client that you're also protecting yourself from getting sick. And if you don't want to make them feel bad, you can also tell them that not only are you protecting yourself and your family, but you want to protect them. And then you can tell them there are clients or people that test positive, but they are asymptomatic. Again, we know that it gets hot. Some people feel like they're suffocated with the mask, but at this point, I think everyone is pretty much used to wearing a mask for longer periods of time. If at any point you do feel as though that you need a break, make sure you walk into a separate room. If they have a balcony, if they have a deck, if you can go outside in a hall, you can make sure that you remove the mask for a little bit, just for a few minutes, and then go back in. Cracking the windows is also increasing your ventilation in the room, so that you can do that as well. When we talk about sharing personal items, I know I have caregivers in the Jersey market that like to bring their own utensils. They like to use their own cups. They like to bring, or you can use paper products, something that you can discard. So when you are sharing dishes, with the client who is COVID positive, you want to make sure that you are washing the dishes with your gloves on in hot water and soap. If you don't have the ability to use anything that is not yours. Oh, there you go, Christine.
Yep. For whatever reason, it's delayed a little bit. There we go.
No problem. All right. So when we, of course, are so grateful that you guys are willing to work with our COVID positive clients, but we want you to make sure that that we have the supplies. We have an abundance of supplies. Many of us carry supplies in our cars because you never know. We've gotten calls saying that our client was exposed, or we have a client that is coming on service first thing in the morning or a Saturday afternoon. We will provide you. So make sure that you call. Sometimes you as caregivers get the call that your client tested positive before we do. Just make sure that you call your office right away, so that way we can get you the proper PPE. This picture just shows where, when you're wearing when you're working with a COVID positive client, you should be wearing a gown. You should be wearing an N95 or KN95, the face shield, goggles, gloves, of course, like we already said, but we have everything. If you wear glasses, that's even better, just in general, but we do have all of these supplies. And again, I have made trips after hours just to drop off PPE as well. And I'm sure everyone in their offices have done the same. Oh, and if you wear all of your PPE and you are potentially exposed, just so you guys are aware, you would not have to quarantine after that. And lastly, for my piece, you want to keep an eye and monitor your own health. At the beginning of the pandemic, when we weren't sure exactly what was going on, we didn't know what to expect. I know that myself and our nurse, Jenny, actually went up to certain facilities and we provided caregivers who did not have thermometers with thermometers so that they can check their temperatures every day. It's something that you guys should do because with the symptoms of COVID, they are kind of presenting itself very differently. Again, the more common ones, and especially the older adults, some of the signs that we saw were, shortness of breath, coughing, loss of appetite, loss of smell, loss of taste. So again, if you may not get any symptoms, but you may get one symptom, definitely, and we definitely encourage for you to get tested. They are changing. The CDC guidelines does kind of change, and some doctors feel that you shouldn't get tested until 5 to 7 days of possibly being exposed. But if you are becoming symptomatic or you do have symptoms or present with symptoms, I would suggest going to your doctor right away. All right. So
I think we should jump past these 2 slides. Sorry to cut in. We're running a little short on time.
Go ahead.
Go ahead, Tiffany. You want to just kind of sum up these 2 slides?
Go ahead. Oh, okay. So basically, can you go back for 2 seconds, Christine?
Sure.
Okay. So once you've been exposed to a COVID, or it could be a family member, it could be another caregiver, it could be a client. You just want to make sure that you notify your office right away. You can return to work after you've completed your 10 to 14 day quarantine time, depending on whether or not you were symptomatic or asymptomatic. Once you are cleared by one of our nurses or your physicians, then you are cleared to return to work. At that point, we can go to our poll.
All right. So you putting up the poll, Adina?
Yeah. Thanks, Tiffany. We're going to kind of shift gears, and we have a poll about the vaccine. Here we go. We'll give also about 30 seconds to respond. Should pop up on your screen.
Okay, so vaccine poll. So we just want to get an idea of if anyone has received it yet, if you want to receive it, or if you don't feel comfortable. We want to try to get an idea of that.
We got 10 more seconds. We'll keep it up for. 5, 4, 3, 2, 1. Okay, here we go. I'm going to share the results.
All right, so we got a lot of responses. Over 60 people have responded, and 27% have already received the vaccine, which is amazing. 41% haven't received it, but would like to, which is even better. Okay. And then we have 33% that say that they do not feel comfortable using the vaccine. So what we've done today is we have a lot of questions and answers for you. And we have Jenny on, who's going to be answering any additional questions that you have we just want to educate all of us. We want to be more educated about the vaccine and know the positives and negatives, and hopefully we can convince some people who are a little resistant to seeing the positive sides of getting the vaccine. So we'll just go ahead to the next slide. Okay. So we have some frequently asked questions here, and Jenny is going to be so wonderful and answer the questions for us. So I'll be reading the question. Jenny's going to answer. If anybody has a comment or additional question, please just use the feature to raise your hand. Adina will be monitoring that, and we can try to call on you for that. So Jenny, the first question is, can a COVID-19 vaccine make me sick with COVID-19? You are muted.
Got it. You hear me?
Yeah. So this is asked all the time. Can the COVID-19?
Yeah. Can you hear me? The first thing I wanted to talk about, though, real quick, is when you go to get a vaccine, sometimes people are afraid of the unknown kind of thing. And I already had my first one. So I just wanted to let you know when you go in, they're going to have you fill out a little bit of paperwork. The vaccines actually are free, but they will ask you if you have insurance, because if you do, they're allowed to charge an administrative fee. Some of the big pharmacies are opening up now, CVS, Rite Aid, that type of thing, and hopefully you'll be able to get your appointments there. When I went in, I had them give it to me in my arm that I don't write with. So I'm right-handed. I have them give it in my left arm. They just give you the needle, just like how you got the flu vaccine, and they have you wait for 15 minutes. You just sit in a nice chair and, you just wait for 15 minutes to make sure you don't have any kind of a reaction. If you have allergies to something like bees or peanuts or something like that, they're going to have you wait for a half hour. And then after that, depending on which vaccine you got, you'll go back. It's 3 weeks if you had the Pfizer, and it's 4 weeks if you had Moderna. And just a couple side effects that you might get is sometimes you have a little pain or discomfort in your arm, maybe a little bit of redness. Some people might run a little low-grade fever, that type of thing. So I just wanted to give you the basics of what you would expect when you got the shot. So Christine, thank you. Back to the first question.
Yeah, it's a pretty popular question. People ask it often, and you hear people tell you this. Is it a myth or is it real? So can the COVID-19 vaccine make me sick with COVID-19? Jenny?
The answer is no. When you get the vaccine, there's no live virus. Nothing live is being injected into you. So therefore, you're not being injected with COVID-19. Therefore, you cannot get sick with COVID-19.
Okay, I know we are running a little bit out of time, so I'm just going to ask a few more of these questions. So if I have already had COVID-19 and recovered, do I still need to get the vaccine?
Yes, you do, because reinfection is possible. So just because you had COVID once doesn't mean that you would never get it again. Okay, they really don't even know yet how long the vaccine is going to hold you for. So you could technically get COVID again. So yes, you have to get vaccinated because COVID comes along with some very severe symptoms. And the safest thing for you is to get vaccinated, because once you have COVID, you can get it again.
All right. Another question that I hear pretty often is caring people going to mandate that all employees get vaccinated?
At this point right now, the answer is no. We're not going to mandate it. The issue is that several patients, their families, and facilities only want aides that have been vaccinated. So what happens is it is going to cut down on the pool of patients and places that you're able to go to. So, that is one issue, but at this time, that answer is no.
Right. Okay. And how much does the vaccine cost?
The vaccine is free, but they will ask you if you have insurance, they're going to ask you for your insurance, and they can charge what I said, that administrative fee, but the vaccine is free.
Okay. And a question that's not on here, but I know a lot of people are asking, is how do you get an appointment? I know you touched on that a little bit. Please, please, please reach out to your local branch if you are having difficulty getting an appointment. Obviously, everyone's kind of in the same boat here, but you are frontline caregivers. So you do, you're on the list. They're ready to take us. It's just, we have to find that appointment. So it's not the easiest thing to do. So that's why I'm saying, please lean on your local branch. We will help you. You can come into the office and we will help you try to get an appointment for a vaccine.
True.
All right.
True.
Let's go to the next page. So these are all healthy people that got vaccines. Isn't that exciting? I got mine too. I'm in the clear now, and there is a good feeling about that. You feel kind of like, okay, are we ready to get back to normal here? All right. And so any questions if we want? I see 2 hands raised. Adina, do you want to go through them?
Yeah, Lakshmi, you have your hand up. I'm gonna unmute you. You should get a pop-up that says the host is asking you to unmute. And you can ask a question.
I had put my hands up from the beginning when I signed in. I'm sorry because
Oh, okay.
anything.
Well, Lakshmi, let's do a high five.
Yes.
I
five.
didn't know what I was doing, but I click, and I tried until I'm on. So that's okay. I'm fine. Thank you.
Thanks,
Okay,
Lakshmi. All right, Ramona, did you have a question?
okay, we'll unmute Ramona.
Can you hear me?
Yep.
Yes.
Okay, I'm sorry, I'm at work, I have my mask on. So my question is, I'm a woman of color and I have high blood pressure and asthma, and I'm allergic to a lot of stuff. I got the flu vaccine and I got the shingles. So I'm really like up in the air with the vaccine. Especially I'm allergic to alcohol. So will they be prepared that not to use alcohol on my arm and use something different?
Yeah, those are all really great questions. I would assume,
Ramona would have to check. Ramona, when you say you're allergic to a lot of things, just alcohol or are you talking, what else?
A lot of medicine, alcohol pads, ultrasound gel, Band-Aids, silk tape, certain gauze I can't have on my arm.
All right, so I think they can just wash your, and when you get there, you'd have to tell them. I think they could just wash your arm with, soap and water or something and give you the shot through there. And they'd have to use a Band-Aid that doesn't have any, maybe you bring one with you, whatever you use on your arm. Maybe you bring a product that you clean your arm with, whatever it might be. And then for all safety, why don't you check with your medical doctor due to all the other allergies, and they'll probably have you wait a half hour, definitely.
Okay, thank you.
Okay.
Thanks,
Good
Ramona.
question. all right.
Marie, I see we have your hand up. I'm gonna unmute you.
Yes, my question is, I would like to know if what's in the COVID-19 vaccine?
What's in the COVID-19 vaccine? Is that the question?
Yeah, because when she was going through the list of questions, she said there's no COVID-19, the COVID-19 vaccine. So I would like to know what exactly is in COVID-19 vaccine.
There, in the vaccine is a protein. It's a protein that's injected into your body. And what happens is the protein goes in and then it helps trigger your immune system to recognize when the real COVID comes in, you understand? Then it goes and attacks it to, trigger your immune system and keep you safe and protect you. So it's a protein that's actually being injected.
Oh, okay, okay.
I think we have time for one more question. Denise, I'm gonna unmute you.
Yes, hi, good morning. Can you hear me?
Yes, good morning.
Yes. My question is, after the vaccine, after I've taken the vaccine, am I required to continue with the weekly COVID testing even though I took the vaccine?
It's a great question.
That is a good question.
I can answer that for you. So right now, the answer is yes, only because we're just continuing to follow the CDC guidelines. We're hoping that that's going to change. I think it will when we hit a certain percentage of the population that has received the vaccine. But right now, just like everything has been kind of like a learning process with this whole thing. Right now, you'll continue to do it. You'll follow whatever rules, if you're in a facility or whatever their mandate is, we're going to continue to follow that until we hear otherwise. But the goal, obviously, is to get back to normal.
You know what, I'm sorry, we actually have two more questions. I think we probably have time to cover the two. Lisa, I'm gonna unmute you.
You're still muted, Lisa.
Oh, you hear me now?
Yep.
Yes, there you are.
Okay. The question I was gonna ask, I was like, after we get the COVID vaccine, do we still get tested? Yeah, but she asked that question.
Yeah, good question. Okay, good. So that was answered for you, and hopefully we'll be able to say, nope, no more testing needed. That's
Okay.
all right, but right now
Thanks, Lisa.
Thank you.
And Latrina, you are going to close up the question and answer session.
There you go. Did we lose her?
I don't know. Latrina, you there?
Oh, we might have lost her.
Okay, all right. Let's jump to the next slide. Well, just so everybody understands, this is not the end of the question and answer. So it is for this webinar, but we do encourage you at any point in time to reach out to your local clinician. We have folks across 6 states joining our webinar today. So the offices, we are all here to support you. Your clinician is here to support you. Please ask the question. There's a lot of unknowns. There's a lot of anxiety surrounding the vaccines, and there's a lot of questions. And we want to try just to give you the information that we have that could help you feel more comfortable about making a decision. As we close up our webinar today, I'm going to just launch one more poll. And it is if you'd be interested in us running more of these COVID information sessions. And based on some of your responses, we'll kind of make a decision about moving forward. So we'll keep it up for about 20 seconds. You got 5 more seconds. Okay. Okay, it looks like about 90% of folks are interested in attending kind of a follow-up webinar. Okay, that's great. We're hoping to have a bunch more of these. And so thank you everybody for participating today. I did want to make one plug for our Caring People University program. Just like we have webinars here and about COVID, we are actually running throughout the year in every region and every branch. We're having Zoom professional development opportunities for all of our caregivers to participate. Most of them are paid opportunities where you will get in-service credit as well. So there's a lot of benefits to you in addition to the content and learning something. So check out our website for that information. It's actually, I'm going to put the website. Yeah, the website's www.caringpeopleinc.com. And there is a link to Caring People University on there. Okay, can I get a drum roll, please? I'm going to stick my hand in my hat, which I don't have. And the winner of our Amazon $50 gift card is Joyce Gray. Congratulations.
Yay. Woohoo.
All right, Joyce, we're going to be in touch. Joyce, I'm going to try to find out which office you're part of and let your office staffing coordinator know that you won the prize today, and we'll connect and I'll get you your $50 gift card. Thank you again, everyone, for participating. Thank you to our presenters. Happy, again, National Caregiver Day. We appreciate you. We love you. We thank you. Have a wonderful weekend, everybody.
Bye, everyone. Have a great day.